Hello class. This is my final project on my career interest, medical dosimetrist. Whenever I tell anyone I plan to pursue a career as a medical dosimetrist, I always get the following question: what is a medical dosimetrist? So in this presentation, I plan on explaining what it actually means and what they actually do. What is a medical dosimetrist? The medical dosimetrist is a member of the radiation oncology team who has the knowledge of the overall characteristics and clinical relevance of radiation oncology treatment machines and equipment, is cognizant of procedures commonly used, has the education and expertise necessary to generate radiation dose distribution and dose calculation collaboration with the medical physicists and radiation oncologists. What does the medical dosimetrist do? After the radiation oncologist has consulted with the patient on their treatment plan, he or she will write a prescription of radiation dose to a defined tumor volume. The medical dosimetrist will then design a treatment plan by means of computer or by hand to determine the treatment field technique that will be delivered for that prescribed radiation dose. When designing that plan, also take into consideration there are dose-limiting structures. These structures could include the eye when treating the brain, the heart when treating the lungs, or the spinal cord when including in the areas of treatment. The medical dosimetrist maintains a delicate balance between delivering the prescription the physicist has written while ensuring the patient does not lose important healthy organ functions. Skills that medical dosimetrists have. They possess the understanding of the technical aspect of radiation oncology and medical physics. They are able to perform routine duties independent of supervision, consulting with the radiation oncologist and the medical physicist as required. They operate and perform quality assurance under the direction of the medical physicist on the direction of the treatment system. They have a working knowledge of radiation safety and current rules and regulation of Nuclear Regulatory Commission. Here are some medical dosimetry images where it's just basically how they isolate, and they would basically plan for the treatment. And these are just different pictures of different tumors in the different parts of the body. Dose calculation. There's a lot of math involved when it comes to medical dosimetry. We need to calculate doses for each individual patient and where the cancer cells are. Every patient is different when it comes to their treatment plan. Precise calculations are needed to make sure that you're not causing damage to other healthy organs. And here you just have some different dose formulas. And here it looks very confusing, but each letter has a number that plugs in. So once you take away all the letters, the numbers will be there, and you can just do simple math. Not simple math, but it'll be easier math. And here you have a table, and it lets you know about how much radiation will go to the particular body part. Right here you have the liver, you have the lungs, and then you have the spleen, and then the testes, and then you have other organs. How do you become a medical dosimetrist? For me, to become a medical dosimetrist, there are a couple ways to achieve this goal. There are a few different college programs to choose from, and this is the college I plan to go to. How do I become a medical dosimetrist? I plan to become a medical dosimetrist is to attend Thomas Jefferson University, that's located in Philadelphia, Pennsylvania, where I receive a bachelor's degree in radiologic science and a certificate in medical dosimetry. My academic plan can go either one or two ways. They offer a 1 and 2 year program So if I end up going and I already have my bachelor's degree and I also have my I'm certified x-ray tech, then I will only need to do 1 year. And then here I would concentrate on medical dosimetry for that 1 year and then get my certification in medical dosimetry. Then they have the 2-year program. So if I end up going to the school and I only have my associate's degree with my x-ray tech certificate, then I will be doing 2 years. And then first year I will be concentrating on radiation therapy, and then the second year I will be doing medical dosimetry. Now I can pursue this kind of 2 ways. While I'm still in the Navy, the Navy will actually send me to school to be a full-time student, and I'll still actually be active duty, but I'll just be going to school for full-time. And that Navy instruction is Navy instruction OPNAVINST instruction 1420.B Chapter 6. And here you just have the requirements to put in your package. So you basically have, you can go on with just your just your associate's degree, and then you would do 2 years. If you have your bachelor's, you would just do 1 year. And for your master's, you would just have to they would just have to teach you how to be an officer. And then the good part about it, once I'm done with this, I'll have my degree, my certificate in medical dosimetry, and then I'll be an officer in the Navy instead of being enlisted. And then I'll still be able to I'll still be in the Navy, and then I'll have my medical dosimetry to fall back on once I decide to get out. Then I can take advantage of the post 9/11 GI Bill. That's where once I get out of the Navy will still pay for my school, and they'll pay for my school. They'll pay for my books up to $1,000, and also give me BAH, which is money for rent while I'm going to school. So this is a pretty good program that to take advantage of if I do decide to get out. What made me choose this career? Here, this is the main reason right here. This is my grandmother. This is why I wanted to become a medical dosimetrist. She passed away of ovarian cancer when I was 22, and I just wanted to get into the cancer field once she passed away. But here's the reason why. My grandmother was my biggest role model and supporter growing up. If I was involved in anything, whether it be sports or after school activities, she was always there. When we first learned that she was diagnosed with ovarian cancer, it was my first time dealing with someone with cancer. And I didn't realize how deadly cancer was because she beat it the first time around. It wasn't until this cancer came back for the second time that I was starting to get worried. I watched my grandmother go from a strong, independent woman who was very active to being so fragile and too tired to do anything. When she passed away, I wish I could have done more for her medically. So that's when I decided that I wanted to work with cancer patients. I began to do research for different jobs, seeing which one better suited me. That's when I came across medical dosimetry. What is cancer? Cancer is basically when abnormal cells in the body begin to grow uncontrollably. The abnormal cell growth is common among all cancer types, but normally in our body, we form new cells to replace the worn out cells and the dying cells, but the cancer cells continue to grow and divide. But because they're different than normal cells, instead of dying, they outlive normal cells and then continue to create abnormal cells, and then eventually forming tumors, which can put pressure on other organs. What is ovarian cancer? Ovarian cancer is basically a cancer that's primarily affects the women that are post-menopause from ages 45, and it actually your chances rises up until the 8th decade of life. So the rate starts to spike actually 54 per 100,000 women between the ages of 75 to 79. But then during the ages of 30, they're only 3 per 100,000 women. So, but uh, close half of the all the women that are affected by cancer will be in the 65 age group. Um, and that's basically ovarian cancer in a nutshell. Here is my ovarian cancer ribbon in honor of my grandmother. I got that not too long ago, just to pay respect. One of many tattoos I have with her name on them or honoring her. Medical dosimetrist lifestyle. Working as a medical dosimetrist, there's many things I'm gonna have to deal with while I'm on a job. The cancer patients aren't always gonna survive, and sometimes they're not gonna survive even though you did everything that you've done for them. In this section, I'll be talking about the salary, why people enjoy their job, and how doctors deal with death of a patient and how difficult it can be. Medical dosimetrist lifestyles. So then you have enjoying the job. I feel like I would really enjoy the job because it's always been a dream for me to work in that field, but then for me to actually pursue and actually accomplish being a medical dosimetrist, I think just because I've been working so hard for it, I've been working towards it for about 10 years now, and just to be able to accomplish that goal and actually work with cancer patients, I think it would just mean the world to me, and just for the simple fact that I'll be working, but it's working towards a cause that's much bigger than myself. And here is something I just researched, and I liked it. I liked it. So this is I'm just gonna read this one part about why she enjoys being an oncology nurse. She says she likes to be able to be there to encourage her patients. She feels honored to be able to care for someone and be there for them when they are going through one of the hardest times in life. On a personal level, she really does like being able to pray with the patients if they ask her to. Also, as an oncology nurse, she's encouraged to continue her education. So she's always getting better, and that way she can treat the different diseases that come up. That way she can better provide for her patients. So here is just a video of a nurse explaining her day-to-day life as a nurse.
My name is Kelly, and I'm an oncology and hematology nurse. I take care of patients with cancer and other blood disorders. A typical day for me involves anything from giving medications to patients, playing with children, whether it be coloring or doing whatever it involves to make them feel better. The biggest challenge of this job is emotionally dealing with the patients and being part of their lives on a day-to-day basis. We get to know them, they get to know us as family and friends. Some patients we see 5 days a week for 2 or 3 years. You've witnessed them going through hard times that no one should really have to go through. The number one thing I hear about my career is, I don't know how you do it. And I remind myself that the patients that I take care of are going to go through this regardless of whether they have a nurse that is supportive or not. And I want to be the person that makes this experience for them better than it could be. As an oncology nurse, we are multitasking every second of the day. If one patient doesn't need something, somebody else does. Math is very important on a day-to-day basis here in the medical field, and especially as an oncology nurse. A person needs to be compassionate, loving, hardworking, I think to be an oncology nurse, you need to want to do this job. I love my job, and this is what I've always wanted to do.
Dealing with death. As much as I'm going to enjoy this job, I'm aware that everyone's not going to survive the treatment. There's going to be times that we've done all that we can do, and the patient's still not going to be able to be alive. But the way I handle the death is going to be real important for my family and my career and my job going forward. This is like an article I pulled up off the internet, talking about how doctors deal with death. I'm just going to read this one caption or one paragraph that I think really stuck out to me. It says, but in our research indicates that grief is having a negative impact on oncologists' personal life, and that there's troubled relationships between doctors, discomfort and with death and grief, and how patients and their family are treated. Oncologists are not trained to deal with their own grief, and they need to be. In addition to provide such training, we need to normalize death and grief as a natural part of life, especially in a medical setting. So it just goes to show me that the doctors also have a hard time dealing with it, and it's just not the families that go through it. So just have to have ways of training and outreach programs for the doctors to talk about their feelings. Here I just researched 3 places that I'm really interested in living. If you notice, all of them are not cold. I hate the cold. So we have San Diego. San Diego, you're averaging about $120,000 a year. But San Diego also has a high cost of living, so it's give and take with that. And you have San Francisco, which is also another place that has a high cost of living, but it's $138,000. So, and all these rates, you have the average, and then you have also, if you've been working in that field, you also get a little bit more money. Then you have Jacksonville, Florida. Jacksonville, Florida, so the cost of living is lower there, so it's not as much, but it's still the weather there. All 3 places, the weather is pretty warm, so I don't plan on going back to the cold. And in conclusion, I hope this presentation helps you help explain what a medical dosimetrist is, so that if you ever hear that name again, you have an idea what they are. And I explain what their job consists of and the population of people that they work with. I also opened up to you and told you why I'm so motivated and eager to pursue this career. My grandmother, she was my heart, and every day I try to honor her by and continue to be the respectful man that she raised me to be. And here's my works cited page. And thank you.